There's an art to every step of this. Picking the right patient, how to extract from the back, what types of loops to use, the team you have, as well as how you implant. This is not something
No.
where you should run off some random hair surgeon that says they do mega sessions.
Sometimes it's healthier, it's better to tell the patient, no, let's do a small session. Perhaps in the future, let's do another one.
If you're thinking about having a giga mega hair transplant, this is where you have 5,000 grafts, 10,000 hairs placed on a single day. I want you to be very cautious. Taking that amount of hair from the back of the scalp and placing it to the front, you have to go to the best person. I have the opportunity today to talk to a colleague of mine, Dr. Alan Wells from São Paulo, Brazil, who happens to be an expert in giga hair transplants. He's going to walk us through the pros and cons of this procedure and help us determine who is the ideal candidate.
Thank you for inviting me. For me, it's a pleasure. We are I'm from Brazil, but great to be together.
Well, I had the pleasure of meeting you this year at the Denver, Colorado Hair Conference, largest conference in the world. And the first thing I want to compliment you about is you are super nice, okay? Very approachable. It's a big thing, so I want to thank you for being so kind.
Oh, no, welcome, yeah. Well, when I began hair transplantation, no one would want to teach me. So no one. It was a very closed field, and I have my colleagues here in Brazil, and I reached to them, and I said, "Well, I'm Alan, I'm plastic surgeon. I just got out of my residency, and I want to learn hair transplantation. And can I go to see you?" No, it was very closed, a specialty, and now it's better. So now we want to teach and we want to spread knowledge. So in these large meetings, I really want to say what I do, and I have a real pleasure in explaining and trying to show the best things that I can do. And I also learn with all my colleagues. So these conversations for me, they are very good.
You know, that is why I love being part of this community as a hair surgeon. I think that there's an openness to share information. And at the end of the day, it's all about improving the quality of the transplants that we deliver to our patients.
Yeah, for sure. So like, I'm sure that if everyone has a really, really good hair transplant, we would be working nonstop. You know, if every patient of us, or all hair surgeons in the world, would have a very, very good experience, I think that we would be working 24 hours, 7 days a week, all the time.
Well, I'm sure that you're very busy because there's a topic today that I want to learn a lot about from you, and that's giga sessions. To start the discussion, can you define what a giga hair transplant is?
Well, that has been changing a lot during the years. So when I began like 20 years ago, if you had like 2,000 follicles, it was, man, immense surgery, like huge surgery. So then we began improving, and around 3,000 was like something, wow, that's amazing. So we progressed, and we now just do the FUE technique. Just we extract single follicles one by one. So it's a lot of work, and everything got better. Machines got better, and extraction punches are better. So for me now, when I extract around 5,000 follicles, that means around 10,000 hairs. I classify that's for me a mega session, a giga session, like a really big session. Okay, but that changes. For some doctors, they say, well, above 3,000 follicles is huge, but we have several colleagues that are extracting around 5,000 follicles. That's a lot. That's controversial. And many doctors will say, never do that. And I understand that, because if you are not very experienced, if you don't use very tiny instruments, it will not be good. So it's controversial, but for me, giga sections are around 5,000.
No, Alan, there's a controversy around taking too many grafts from the back of the scalp. I perform both FUT and FUE.
Yeah.
There's a safe donor area.
Yeah.
I don't have to tell you, but I'm explaining that to the audience because there's going to be patients watching. I always caution patients about the importance of preserving the back of the scalp and not taking too many grafts. So when I hear 5,000 grafts, it makes me pause. How do you feel comfortable taking that many grafts from the back of the scalp?
And yes, and you are right.
And I want to apologize for challenging you.
That's
because this is a topic that has a lot of controversy in the hair community.
Yes, and that's great. I think that good doctors, very good transplant doctors, are very concerned about our donor area. We need to be conservative. We need to tissues they have to stay healthy, you know. So I understand if you go beyond 2,000, near 3,000, it's a lot. It's a lot. So I'm very comfortable in doing 2,000, 3,000, and if I can do less, is better. So if I have a patient like is class 3, class 4, and I can do less, it's way better for the patient. So we have to be very careful. I'm talking here about giga sessions, but that's when patients needs it. That's when the team is accustomed to do that. It's not for everybody. So we need to stay safe, and that's what good doctors do. So I think if we stay around 2,000, 3,000 hairs, like it's a normal strip surgery is around 2,000 something, it's good. You know, we preserve tissue, everything is healthy. I have like a bank that I have more follicles for the future, and that's very, very important. No, so if I can stay around 2,000 follicles, that means around 4,000, 5,000 hairs. That's great. So giga sessions are exceptional surgeries, but I do them a lot. But because of my experience with very, very, very tiny punches, and I'm very experienced in managing to take intact grafts with punches less than 0.9. It does not mean that I have to do all the time giga sessions. So we have to stay safe. We have to make the donor area safe. We need a good growth of our hairs. So if I can stay lower, I will stay lower, and I explain that to our patients, you know. So good doctors do that. The lower that we can use with excellent result is good.
Absolutely, I agree that less is sometimes more.
Yeah.
Now, how do you pick the right patients for a mega session? What is the criteria that you look for? Is there a certain age? Is there a certain progression of hair loss? Is there a certain type of density?
Yeah. So first of all, that's what we are talking. If I can stay around 2,000, 3,000 follicles, great. But since I got more experience and I got more, really, 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 my team is really prepared for the giga sessions. And if a patient is like class 5, 6, and has a normal donor area, normal to good donor area, I go to higher numbers. Okay? But I just do that knowing that I'm going to use really, really small punches. What do I mean small punches? Less than 0.9 millimeters. 0.9 external, the external measurement.
So the internal is going to be 0.85
or less, because it depends
or
on the
less.
wall of the kind of material that's the punch. Some punches, they have the internal lumen, the internal diameter like 0.7, and the external is 0.9. So it depends on the material. Okay, but
And what is the benefit of using these smaller punches when you're doing a mega
first
session?
thing, that's important. Why I'm saying that? Because when I began, a lot of experts told me, well, if you use 0.9 or 0.95, you are great. You're going to, the tissue is going to be healthy and it's going to be great. So I bought a lot of 0.95s from the surgical meetings, and I was very happy extracting with them. And then I realized that they were not 0.95, the external diameter. They were like 1 point something, 1.1, 1.2. That 0.9 something was the internal measurement. So it was a huge mistake. And what was going on? I was seeing a little bit more damage. You can see the extraction dots, so that's not good.
You're referring to the hypopigmentation that you can get
Hyperpigmentation,
after having an
yeah,
FUE
yeah, yeah.
procedure.
So that was a mistake like 10 years ago. I thought I was using small punches and they were big because they it's written there, oh, this is a 0.9, but it's just internal diameter. So it's not right. You have to think of the external. Okay, if you have an external diameter measurement that's 0.9 or less, I know that I'll not have white dots, that visible ones. I know that I can extract one hair really close to the other. And then when you see hairs growing again, it's like normal. It's like you just decrease the density of that patient, but you cannot see that he went to a surgical procedure. Do you understand that? That's very just a key point. If I can extract a lot of hairs here, and then after 6 months, you look the donor area, you cannot tell that he had a hair transplant.
But do you still believe that, and do you still see that after these mega sessions?
Yeah.
Because I could believe that with 2,000,
No, no,
2,500 grafts, but with 5,000 grafts, I would be
no.
skeptical.
You can extract as much as you want if you have punches really small. That I'll explain that to you. That's important. If they are really small, like 0.8, something like that, you extract a lot and you do not have signs of extraction. So you're going to see your patient. Of course, he's going to be with less hair here. Okay, but that's normal between patients. We have patients with really high density here. We have patients that have medium density here. We have normal people that has less density here. Normal walking the streets, like that's normal. We see people with less density here. So if I do really big mega session and then I do another one, so several, and I use the small punches, he's is going to be a patient with not high density here, perhaps a lower density here, but that's normal. We see people all the time like that. So that's the key issue. You can lower the density here if you do not leave marks. That's normal. Now, we see over harvesting all the time. I see that all the time, but that's because of bigger punches. Okay, when you have bigger punches, you see, not, wow, that's strange. I see over harvest it's not beautiful. But if you use really small, you're going to have a healthy scalp and hair growth here, and you're going to see less density, but it's like normal. Of course, you have to respect. You never take one follicle besides the other. Never. Like you have 3 follicles, you can extract here this and this and this, and that's a lot. If you just jump one, you are extracting around 50%, and that's very controversial. Very, very controversial to extract like 50, because we accept, like experts, oh, you can extract around 20%. That's good. But some cases we extract more, 40%, and everything is perfect. Do not sit over harvesting because you have really small punches. But that's controversial because you have to be accustomed to that. You have to use small punches. Everything has to be atraumatic and very gentle, and it depends a lot of experience of the surgeon.
Okay, so I hear punches is important, but how about the age of the patient?
Okay, if you have really young patients, perhaps they don't heal that beautiful. We know that younger patients, you have to be more conservative, always.
But also, don't you also have to think about how their hair loss is
Yeah,
progressing?
yeah, yeah.
They might have an encroachment from the
Yeah,
crown.
yeah. That's
You have to preserve because they might need future hair transplants.
That's why younger patients, you have to be conservative. Two aspects of that. You have to be conservative because you don't know his hair loss progression. You don't know his genetics. for sure. So younger patients, always be conservative. Don't do really mega sessions. I never do a mega session with someone in his 30s because I need the patient to be stable if I'm going to do something more.
Yeah, because I bring that up because we hear a lot about young guys specifically who go to Turkey.
Yeah.
I use Turkey as an example, and they're all promoted mega sessions in
That's a
Turkey, and I'm like, don't go.
yeah.
It's a risk.
It's a risk because young patients, they want everything. They want to be like as they were 15 years old, 18 years old. They want to be very hairy. Okay, so it's a mistake to do really giga mega sessions in young patients. We experts, we do not do that. So if you're in your 20s, early 30s, it's not good to do really big sessions. You have to be conservative because you don't know how his hair loss is going to go. And we know that younger patients sometimes do not, the healing process are not as good as mature patients. But the main reason is you have to be conservative because you don't know the progression of his hair loss. So you are right. Younger patients should not do real big sessions.
And why do you think younger patients heal differently than older
Oh no,
patients?
we know that I used I did around 15 years of FUT, and we know that a patient that it's like over his 40s heals better. Okay, it's very rare to have a hypertrophic scar in someone in his 50s. For us plastic surgeons, we know that, and if you have someone in his 20s, is more common, to have hypertrophic scars. So real young patients don't heal as well as older patients.
Let's talk about another thing in terms of assessing who's a good candidate. How about hair caliber? Like, for instance, looking at black patients or female patients or curly hair, is there a different approach that you take?
Yeah, really good question. The hair caliber, it means a lot. Sometimes we have a patient that has 50 microns of his hair shaft, and we have patients that has 80, okay, 90. So if I can use almost half of the follicles and have a greater result that someone that has a real thin hair. So sometimes I extract 2,000 hairs of someone that has a really good hair caliber, and it's way better than 5,000 in someone a thin hair. Okay, so that's very important in our surgical plan. Very important. So if I have someone that has a wavy kind of hair, I can use less follicles. I have someone that has thick hair. Thick is around more than 60 microns, like 70 microns, really good. So I know I can use less. And you are very right. Less is more for us. We have to be very careful with advertising, and we have a lot of internet stuff nowadays that the patients sometimes just look for numbers, and that's very wrong. Very wrong. Less is more. If I can use less follicles, it's way better for the patient. Of course, I will use some cases less follicles, but I know I'll have a great result because of planning. I know his hair is thicker, and I know where to insert the grafts and the proper angles. So that's very important, the hair caliber. Very important.
How about with black patients? I would be concerned about these mega sessions with the possibility of forming
Yeah.
keloids from all these
Yeah.
micro punches.
I never do mega sessions in patients that have really wavy hair, like in patients that I know that can have more frequency of keloids. So all this stuff of mega sessions is just I say no, I do that, but be careful. It's not that I do that for everybody. If black patients they have more tendency for keloids, I'll never do a mega session. Or any patient that has wavy hair, really wavy hair, we do not do mega sessions because look how it's important. Patients that have real wavy hair, I need bigger punches. So sometimes I
So you're concerned about the keloiding or
Yeah,
scarring,
yeah,
post
yeah,
scarring?
yeah. That's very important. If I need a bigger punch, like more than 0.9, I'll never do a mega session. That's real important. So if the patient has a real wavy hair, and during surgery, I see it's impossible to take this hair with just 0.85 or 0.9. I have to go to 0.95 millimeters or 1 millimeter. That's a lot for us. So I'll never do a mega session, because if I extract too much, it's a lot of damage and you leave surgical points, and that's not beautiful. So wavy hairs, not good candidates for real mega sessions, but wavy hairs, they make more volume. So I don't need mega sessions. So I'm always concerned about my planning, always concerned about the size of my punch, what's the age of the patient. So everything we take on consideration.
How do you prepare a patient for a mega session? What do you warn them against? I mean, you have to tell them about side effects, obviously, but how do you
I
prepare
don't
them in
know.
terms of?
Okay, if I have a patient that's suitable for a mega session, so I say, oh, this patient, I can take 5,000 hairs. I know that's a patient that looks for me a good case, like I straighted, the hair is straight, so it's easier for extraction. He has a good donor area. I know that has a lot of follicles per square centimeter, like 80, so it's a good candidate. Is a class 5 or more Norwood, and for me it's normal case. So I don't warn about, oh no, this is a different case. I go, no, we just use smaller punches in our daily routine.
How long does it take you to do a mega session? What's a typical kind of breakdown of the day?
We have a huge, a big team. So everything for us is 8 hours. Sometimes I do a smaller sessions, I go slow, 8 hours again. So, but I have real good, big sessions, we spend 8 hours. Always like this: 2 hours extracting half of the donor area, okay? 2 hours extracting the other half. So we have around 4 hours of extraction, okay? And the other 4 hours is all those, because to insert the grafts, we go fast, but always have a break and patient goes to the bathroom or we have to change his position. It takes 8 hours, but we insert grafts in really high velocity, around 3,000 an hour, and that's fast. But we have a big team. I have 9 technicians with me, 9 or 10 all the time. So everything is very fast.
So it's a very long day, very big case.
Yeah.
Um, Clearly, what do you do with patients after? What's the recovery process like after a mega session? Is there anything different
No,
than a normal session?
no. It heals well and everything goes well. Patient, the day after surgery goes to my office and we clean the scalp. I like to do a laser, and that's good for healing. But normal case, like the day after, patient can work, can go back to his daily routine, and everything is fine. Everything is fine. After 1 week, no scabs, normal week.
You're not concerned at all in terms of the blood supply, in terms of transplanting that
Zero.
many hairs in one session?
And not, I'm not like advertising mega session. So when I see a good case for mega session, it's a normal case. Okay, because we don't have big trauma. Okay, uh, smaller punches, that's the way to do it. And of course, everything is very gentle. The anesthesia, very gentle. We don't use too much like adrenaline, those things that cause vasoconstriction. And everything is very gentle, very good surgical technique. So we don't need to be worried. I think that if you are worried about the outcome, you should not do it. Like, if I'm worried, like I'm worried with this patient doing a mega session, I'll never do it. Why should I be worried if someone is really a smoker, if he's diabetic? You should be worried. You should not do real big sessions because he can have his healing process impaired. So this kind of patients you should not do big sessions.
When you do the extraction, are you using a lot of tumescence?
No, no. So I don't like a lot of tumescence. I don't like a lot of medications. Everything has to be very simple. So I just use the really small amount of anesthesia, the certain amount, the precise amount that patients don't feel anything, and not much tumescence and not much adrenaline. So everything is very like organic and very precise. I don't use medications like after surgery. He doesn't take anything. Our patients don't take anything after surgery. So everything is very delicate and very precise.
It's the same kind of approach we have in our
Yeah.
office. Less is more
Yeah.
in terms of how much we use for tumescence, and also, it's surprising because hair transplants are really kind of painless in a sense, where patients go home, they don't need painkillers. Right? They obviously develop swelling, but in terms of pain, the pain is almost minimal.
Yeah, we know that
Um,
10% of patients, for me, 10% of patients have a little bit more of pain. Like after the fifth day, the scabs are falling out. They feel like itchy and sometimes like burning, and depends of the sensibility of the patient. So we have patients that say, "Oh, it's hurting." Yeah, we do. And then I give him a mild anti-inflammatory like Tylenol, like something very easy, okay, and just that. But we know that 10% can have more pain. Some patients, like once a year, twice a year, I have patients say, "Wow, it hurts a lot, real a lot." And we have patients that are different, has more sensibility. That's normal. That happens, but it's not our daily routine.
Absolutely. We're always going to get some
Yeah,
complications or patients that are a little more
yeah,
difficult. I agree with
yeah.
that. Now, Alan, you've been doing mega sessions for a while. I'm curious, what is your philosophy about keeping these patients on medicine in terms of hair loss
Okay,
medicine
okay.
to preserve grafts? And what do your results look like 5 years later, 10 years later?
Yeah. So I have a real like a conservative approach. Patients, a lot of patients don't want to use medicine, hair loss medicine after transplants. And I understand that. So I tell my patients, well, if you want more longevity for your hair, it's good to use something. It's good to use or finasteride or minoxidil. You're going to stay with your hair more beautiful for decades. Okay? And some patients tell me, "Oh, but I don't want to use anything." And I said, that's okay. Just you need to understand if you want longevity, it's good to use something. If you do not use anything, it can happen that in some years your hair loss can progress, and here the donor area can lower, your crown can lower, your remaining hairs that you had before surgery can disappear, and you have my hair transplant. It's going to stay, and that's okay. You have more hair because we had a hair transplantation, but you have less result for sure if you don't use anything. So I usually advise like if you use, it's better. But if you don't want to use it, that's okay. But I warned him that perhaps in some years, like 5, 10 years, he can come back and he can say, well, let's have another hair transplant. So, okay, that's great. But if you want longevity and use, so we love to use finasteride, we love to use minoxidil. I think it's important, but I understand patients that tell me, no, I don't want to use anything because I don't like it. But oh yeah, no, I understand. But I want longevity for my hair. So okay, let me use some finasteride for 2 years, and then it's okay. Then let's see how it goes for the next decade.
The philosophy at our office is that to get the best hair transplant results, it's a combination of, yes, the hair transplant, but also a commitment to being on medical therapy. We try to drive that message because it is a financial commitment to getting these hair transplants, especially these mega sessions. So the last thing we want to see is our patients lose these follicles.
Yeah, and that you are right. You are right. So we have to advise them. If you want long-term result, it's better to take medications.
So what do your results look like 5 years, 10 years later? Have you been able to
Yeah.
appreciate these mega sessions, and how your patients look all these years later?
Yeah. So I always try to plan my surgery to look very good after 20 years. So that's always my goal. So if this patient like difficult distraction and I just did a really small surgery, I'll plan that. I'll plan where to start my hairline, how I do my curve for him to have a high density where it means the most in aesthetically vision. So our patients that come after 15 years, usually they look great, okay? Because I usually plan and I think, wow, how is he going to look 20 years from now? Okay, so I try to plan the distribution to look good. But of course, we have a sum of what I inserted and plus the hair that he has now. So if he loses a lot of his hair, he's going to be not that good. But I usually in my planning I think, well, this patient he's not going to use medication, he's going to lose a lot of his hair, or he can tell me, oh, my family is real bald, grade 7. So I think, this patient he can take medication and even doing that he's going to progress. So let me be sure that just with my transplant, it will look good. And so I planned like a hairline with more curve, but he looks good. Anyone that has more hair, like in a really good place, location, it looks very good after 10, 15 years. But it depends on the patient, depends a lot. But I always trying to think long term.
Now, I don't think our conversation's complete before we talk about how you think about hair design and your approach to implanting with these mega sessions. I know that you use soft implanters, and I'm very curious to hear kind of how, number one, how do you lay out what's your philosophy in terms of how you design the hair line, the forelock, how many follicles are you aiming for during a mega session? And then, of course, I want to hear about why using soft implanters versus sharp implanters versus making sites and then using forceps is a better approach, in your opinion, for these mega sessions.
Okay, for the second question, I really think that the soft implanters, the dull implanters, are way better. And I'm going to explain that. But the first question, how do I plan my design? How is that? My curve, do I start my hairline?
But also, I want to know how many hair follicles you're putting into different regions when you have 5,000 to work with or 10,000 hairs.
Yeah. So, first of all, that's for me, is very artistic. So, there's not a rule, you know? Very artistic. I see my patient, and this patient needs a higher hairline. I think looks more natural as he's going to age, and I'm going to make a higher hairline. Or sometimes I look the patient, this patient, he'll get really handsome with a kind of a classical hairline. It can be a little bit lower. He looks good like that. And I know I can achieve a high density over his scalp. So first of all, it's very artistic. But thinking broadly, like in general, the first the first third and the mid scalp, it has to be really dense. I know that I believe a lot of gradient of density, like it has to be more dense in the beginning, in the mid scalp, and then gently, like slowly for the back, he can have lower densities. This is much more beautiful than everything the same, but not real dense everything, you know? So it's important for me always the beginning and the mid scalp has the biggest density that I can for that case. But with the way I approach and the hairline, as personality of the patient, for me, is art, and that's not a rule. But in general, we have to avoid straight lines. We always need recessions, always micro irregularities, perfect angles. And I try to give high densities in the beginning. What's high density? For me, it's like around 50, a little bit more, like 60 in the first centimeters of his hairline. It's beautiful if I can do that. And in some cases, I look and I think this is not beautiful. It's if it's high density in the beginning. Like in general, older patients, it's not that beautiful. Like a thick wall, it's not beautiful. Like I have a patient like around his 60s, 70s. It's beautiful to have a little bit of see-through. Like you can see a little bit of his scalp, and everything is so natural. So that's a little bit of art that we do, and that's why I love hair transplantation, because we can exert our art. So there's not a rule. But for older patients, never go too dense. It's not beautiful. Try to avoid straight lines or lower hairlines. You have to try to avoid that. Okay. So I don't have a rule. And in my placement of hairs, I did everything you can imagine, all techniques, forceps and all kinds of techniques. And but now I use only implanters, and I used around for 10 years sharp implanters. So I'm very good in sharp implanting, talk fast, and that's okay. And then I changed it to the soft implanters that you said, like dull implanters. That means that I have to do pre-made sites here first. But when I do pre-made site, so the site's done, and then the implanter, it can go in a very, very low pressure. If you have a sharp implanter, it has to be a little bit of pressure. The needle has to get in, okay? So, of course, if the needle is very sharp, it's good. If the needle is very small, like 0.7, is good. But you have to be a little pressure.
By the way, are you using a hardcore needle to make the sites, and then your team comes in with the
No,
soft implanters to do the
pre-made.
actual implanting?
I have my guillotine. I make my blades. Okay, I have customized blades. So I have a guillotine, and I customize my blades for every size I want. So 0.6, 0.65, 0.67. I use a lot of 0.7, 0.72. So it's very, very precise. And I customize my blades.
Why is that important? Why is it important for those sites to be so small?
Yeah, because less damage to the tissue, more blood supply. If you damage too much, you have less blood supply. So it has to be small. It's important as you progress and you do mega sessions. Everything has to be small. Here, instruction, and also for you to do the pre-made sites. Never I use anything more than 0.7 6, never. So 0.8, never. Okay. Of course, 10 years ago, I used to do 0.9, and everything is okay. But we progress, technique, technique, technique. So very small blades, never go deep to the neurovascular vessels and nerves, never go deep, never damage that. So you have a little bit of tumescence in the scalp, just the necessary to give me like a cushion, like more space, and I never reach the neurovascular plane. Do you understand? So everything is smaller, better. Smaller is more difficult also. So I use 8 times loops. That's a lot. All my technicians use 5 times or more loops.
I use 6.5, so yeah.
So you are my team.
But you know, it's interesting. We're getting off topic, but in terms of loops, it's interesting that most hair surgeons use 3.5s. I don't know how they see anything, actually.
So I know very good surgeons that use just that little shield. It's like 2 times, and you have to be very close. It's every time I progressed in my loops. Like I used to do 4.5, and then I went to 5.5, and then when it changed, I saw it's wow, everything is so bad that I'm doing is not precise. I have to get better. Good. And then when I went from 5 point something to 6.5, then I looked again for wow, I'm very bad. I have to get better. Look, this, it has to be much close and blah, blah, blah. And then I went to 8. I said, wow, I have to get better. So when you loop everything, your standard goes up. So if you are 0.7,
Absolutely. I'll tell you something. I cannot go back.
yeah,
Since I've been using 6.5, I would feel like I'm blind.
yeah.
If I had fives or fours, I wouldn't feel like I wouldn't see what I'm
So
doing.
that I know that you're a very good surgeon. Just telling that, oh, you use 6.5, you have to be very good because you have, like, you see that you have to be dense and have to be, and you cannot go back. I don't know anyone that went to like 6 and, oh, now let me go back to 3. Never. So yeah, that's important. So I can do my more density. So I use the soft implanters because when I insert grafts, the site's already made, so it does not pressure too much the skin, so I don't have a pop out. So I can be very, very dense and don't have pop out, so it's good for us.
We covered a tremendous amount about mega sessions today. And my big takeaway is each step of the process matters. There's an art to every step of this. Picking the right patient, how to extract from the back, what types of loops to use, the team you have, as well as how you implant. This is not something where you should run off to some random hair surgeon that says they do mega sessions. You really have to seek out someone like yourself, Dr. Wells, where you have a tremendous amount of experience, not only with success, but managing complications.
Yeah, yeah. And you're very right. So sometimes it's healthier, it's better to tell the patient, no, let's do a small session and perhaps in the future, let's do another one. Okay. A patient that smokes, let's do a small session and then do another one. So we have to be careful all the time. So this theme mega session, I do that. But for me, the most important is not that I do that. Most important is that I make a natural result. For me, we had a presentation in one of our congress that one surgeon just uses a small amount of grafts, always just 1,000. And I loved his lecture because he can manage to give a natural result with really small numbers. And that's art. I tell you, get a grade 7 and just give 1,000 hairs, but make it natural. If you can do that, you are an artist. For me, it's important the natural stuff. It doesn't matter if it's big sessions, a medium, a smaller session. The patient has to trust on you that what we think is better, let's go. Because transplant is difficult. You should never, like you said, like a not experienced surgeon, you should never go to that. But transplant has a very learning curve, and nowadays we see in the internet a lot of advertising. Oh, we do high numbers. Go to that country. The worst thing is if you have to trust your doctor. He says, "Oh, let's do this number is good for you." That's great. Less is more. It's great. Like you say, oh, that's a good doctor. He's taking care of me, not just advertising. That's the most important thing for us is to take care of our patients as if they were our family. And that's the most important thing.
That is my philosophy as well. I have the pleasure of working with my father, and we take that approach in terms of how we take care of patients. The last thing we want to do is cause complications.
Yeah.
So, Dr. Wells, I want to thank you so much for joining us today on the Hair Doctors Podcast. You are amazing. And if anyone's thinking about having a mega session, Dr. Wells should absolutely be at the top of your list. If you have any questions about mega sessions that we have not addressed, leave them in the comments below. I'll make sure to address them. And Dr. Wells will also help to respond to questions. So as always, we are both here to help you address your hair loss. I really hope that you're enjoying our podcast. We try to bring on our colleagues who are the world experts in hair loss and hair transplants. If you're enjoying what you're listening to, hit the subscribe button and don't forget to listen to the next episode.